Breast cancer is one of the most common cancers diagnosed in women. It's very important for women to be educated on this topic and also to be proactive in your prevention. The most important way to detect breast cancer early is to do self-breast exams. I always encourage patients to feel it on the first, and it really just marks a reminder on the calendar to do your self-breast exam. This is important so that you know what your normal is, and anything that deviates from that normal is really a cause to see a doctor, particularly if it doesn't go away quickly. So for example, if you see any skin changes, nipple retraction, nipple discharge, or really any new lumps or bumps on your breast, certainly speak to your doctor. There is a genetic component to breast cancer in about 6 to 10% of cases. In the majority of cases, there is not a known genetic component. But given that many patients have cancer in their family, it's important to tell your physician your entire family history so that they can help you decide if you're a candidate for genetic testing. There's no typical course of treatment for breast cancer. No two cancers are alike, and every patient really needs to be considered individually to see what's your best treatment option. These treatment options might include radiation, surgery, or even chemotherapy, but you really need to talk to your doctor to see what your specific cancer looks like in order to determine what your best treatment course is. Not all patients who have breast cancer actually need chemotherapy, but oftentimes when patients do need chemotherapy, their biggest concern is, will I lose my hair? The unfortunate answer is yes. If you are getting chemotherapy, your hair will fall out. But the great option here is that the RWJBarnabas Health system offers something called the Paxman cooling device. And this is an option for women to actually wear something on their scalp to cool down the scalp and prevent hair loss during chemotherapy. Patients always ask what they can do during their chemotherapy or radiation treatments to stay healthy. The main thing that I really encourage patients to do is to eat well-balanced meals. That way you maintain your weight, you don't lose weight, and if you're able to, if you don't have significant fatigue, try to get around and move as much as possible. Go outside, take a walk, do something small. It really will help your energy, even though sometimes it's difficult. While breast cancer is still a very daunting diagnosis, in the last 20 years, we've seen significant advancements in treatments, and we expect that these will continue into the future.